In this video, I'm going to discuss investigation and nursing and medical management of cystic fibrosis. In the previous video, already I have discussed definition and signs and symptoms and pathophysiology of cystic fibrosis. So in this video, we'll discuss the investigations and how do we manage cystic fibrosis. As we all know, cystic fibrosis is an exocrine dysfunction and it is affecting multi-system, for example, respiratory system, GI system, integumentary system, and reproductive system. Early investigation, early identifying the disease and cause of the disease and treating as soon as possible is very important to maintain a normal life. So we'll see what are the investigations that is usually helping to confirm the diagnosis. So without delay, we'll move to that. So I'll just share the screen and yeah, please tell me whether the screen is visible. I hope it's visible. Okay, so please go through the screen as well. So in investigation, usually we use a sweat chloride test. So this is the confirmatory investigation that is normally used to identify or diagnose cystic fibrosis. Okay, so what we do normally in this particular procedure, normally we stimulate sweat by giving injection pilocarpine, and this particular injection is given through iontophoresis method. That is the route of administration of this medicine. It is a kind of medicine administration in which we use a small voltage of electricity and just spreading the medicine on the skin, which is locally. Okay, so it's not considered as a local application or intradermal injection. It is using or it is spreading over the skin through iontophoresis method. Okay, so after the sweat is produced, then you can collect the sweat, a certain amount of sweat, and monitor the amount of chloride which is present in the collected sweat. Okay, so this is mandatory to know, and you need to understand the interpretation values also. For all nursing exam, you may get the question. Clear? So, എല്ലാ നഴ്സിംഗ് എക്സാംസിനും ഇതൊരു ഇമ്പോർട്ടൻ്റ് ആയിട്ടുള്ള ഒരു കാര്യമാണ്. ഇഞ്ചക്ഷൻ പൈലോകാർപ്പിൻ കൊടുത്തതിന് ശേഷം സ്വെറ്റ് കളക്ട് ചെയ്ത് ആ സ്വെറ്റിൽ എന്തുമാത്രം ക്ലോറൈഡ് ഉണ്ടെന്നാണ് ചെക്ക് ചെയ്യുന്നത്. ഓക്കെ, സോ വാട്ട് ഇസ് ദ നോർമൽ വാല്യൂ? If it is less than 40 milli equivalent per liter, it is considered as quite normal. If it is 40 to 60 milli equivalent per liter, it is considering suggestive symptoms of cystic fibrosis. And if it is greater than 40 milli equivalent per liter, it is considered positive sweat chloride test. Clear? So this is the investigation. Apart from this, we normally assess the signs and symptoms and multi-system affection. Everything we need to check, but this is considered as a confirmatory test. Okay, and next we will discuss how do we manage. Okay, as in the beginning itself I said, this is affecting multi-vital system, and this is affecting respiratory system, GI system, integumentary system, and reproductive system. Okay, so how do we manage? So always we need to give more priority to respiratory system because it is affecting the airway. So first we will discuss the management of respiratory system. You have to follow the priority order too. Fine. So how do we manage in respiratory system? See, as we all know, in cystic fibrosis, respiratory system or the respiratory tract is completely plugged or obstructed with the produced secretions or obstructed with secretions. Okay, so what happens in cystic fibrosis? Normally all of these secretions are not able to expel out, so it gets accumulated in the respiratory system itself. So what is your goal in management? So please remember the goal. You have to increase the oxygenation. How do we increase oxygenation? If you want to increase oxygenation, either you can increase oxygenation, that means the oxygen supply you can increase. Otherwise, the pathway where the oxygen is moving, that should be like open. Fine. But in cystic fibrosis, it is exactly opposite in manner where oxygen is not easily moving into respiratory tract because of obstructed airway. So you have to focus on opening the airway. So improving aeration and removing secretions are the prime priority. in management, and you can administer antibiotic. Why this is important? Why administration of antibiotic is important? Because when your respiratory tract is plagued with the secretions, it enhances the chances of infection. So taking measures to prevent infection is very, very important. Clear? So all these three aim always you should keep in your mind while managing cystic fibrosis. Okay, so what all are the interventions which is included? Number one is chest physiotherapy. So what is chest physiotherapy? That is helping to mobilize the secretions. Okay, so chest physiotherapy should not be performed before immediately after meal. That particular point is important. And what is the importance of performing chest physiotherapy? When you perform chest physiotherapy, it always vibrate the chest and it help to remove or mobilize the secretions. Okay, as soon as we provide chest physiotherapy, it always help to move or mobilize the secretions. That is always enhancing to remove or take out the secretions. Clear? And please remember one more thing, that is, before chest physiotherapy, for the better evaluation, you can provide a nebulization before chest physiotherapy, at least a half an hour before or 15 minutes. That is more than enough. Before 15 minutes, you can perform you can provide a nebulization, and after that, then wait for 15 minutes, and then if you perform chest physiotherapy, that gives you a very good result. Clear? So that particular point is also important. See, for all of your nursing exam, you may get questions related with all these points. Okay, so because this is a nursing management. Clear? And next is bronchodilator medications. Why it is important? When you administer bronchodilators, it always dilate the bronchus, so that enhances easy movement of oxygen. Clear? And next is use of flutter mucus clearance device, that always help to thin the secretions, and use of West device therapy. This always gives a frequency of oscillation on the chest, and that always vibrate the chest, as well as it is automatically vibrating the secretions, which is closely attached with the respiratory tract. Okay, so you have to just remember what is this West device therapy is used and what is the indication. Okay, and next you can administer human deoxyribonuclease. This is always helping to liquefy the secretions. Okay, normally this is acting on the mucus and it will reduce the viscosity of secretions. What is viscosity? It is thickness. So it is reducing the thickness, so it will flow very easily. And when the viscosity is high, obviously that obstruct the flow. Fine. Instruct the parent not to give cough suppressant. See, in this particular child or a patient, they may have symptoms like cough with expectorant or without expectorant. So in case of cough, normally we give cough Medicare, cough syrups. Okay, so there are two kinds of cough syrup, cough expectorant and cough suppressant. Okay, so whereas in respiratory system, we don't prefer cough suppressant, which is containing codeine. Fine. So when you administer cough suppressant, it will suppress the cough. As a result of that, the entire secretions get accumulated inside the respiratory tract itself. So better to give cough expectorant rather than cough suppressant. Okay, so please remember all these points and teach the child forced expiratory technique, that is huffing, to mobilize the secretions. That particular point is also very important. So when a child perform a forced expiratory technique, that expand the lung and it is helping to increase the oxygenation and mobilizing the secretions. Okay, develop physical exercise program. So immobility always increases chances of accumulation of secretions. When you are not mobilizing, it always accumulate the secretions faster. But when you are mobilizing, it always promote the movement of secretion. So immobility always causes respiratory infections. And see, in case of respiratory disease, there are chances to get immobility. Why? When a person is doing activity, that increases the oxygen requirement, right? When we are doing activities, it increases the oxygen requirement. So body need to consume more oxygen. So the symptoms will worsen, right? So for all respiratory disease, immobility or activity intolerance are expected, but as a nurse, as a competent nurse, you should enhance the patient to perform physical exercise. This is something important. And administer antibiotic, already I said, and aerosol method is used for administering antibiotics. What is aerosol method? It is administering any kind of medications in a small fragments. Okay, so this medicine is converting into small fragments. Example I can give, like nebulization or steam inhalations. Okay, and then administer oxygen, that is important, and monitor hemoptysis. Okay, what is hemoptysis? It is blood tinged sputum. If it is greater than 300 ml in 24 hours for an older children, that is lesser for younger children, and need to be treated immediately because that is indicating an emergency situation. So this particular point is something very important. And another thing is hemoptysis may be controlled by bed rest, cough suppressant, because when you give cough expectorant, that is a better medication. But when you give that, the patient will repeatedly cough, and that again increases bleeding. So if patient has hemoptysis, better bed rest is important, and cough suppressant you can provide. An antibiotic, vitamin K, it's to control bleeding. If hemoptysis persists, the site of bleeding may be cauterized or embolized. Fine. So this is the considered as the last management, and lung transplantation is the final therapeutic option, which doesn't considered as the primary management. Primary management is always the measures in which enhancing oxygenation as well as dilating or enhancing oxygenation or removing the secretions. Okay. And in terms of gastrointestinal system, what are the points that you need to remember? See, in gastrointestinal system, exactly what happens. Normally, all these exocrine secretions from pancreas is not easily coming to duodenum. As a result, metabolism get affected. So that is the pathophysiology. And while managing, what point you need to remember, that is improving the metabolism by replacing pancreatic enzyme. Okay, so the pancreatic enzyme can be administered with a meal or snacks, or within 30 minutes of eating meals or snacks. This particular point, underlined point, is very important. When you want to administer pancreatic enzyme, it has to be administered with a meal or snacks, or it should be administered 30 minutes after or within the food. Okay. Why it is important to ensure the digestive enzyme are mixed with the food at duodenum. Okay, so what are the pancreatic enzymes? That is amylase, lipase, all kind of pancreatic enzyme, which is based on the food what we consume, that need to be given. Okay, why it is important? In the pathophysiology already we have discussed that the secretions, pancreatic juices are not really moving into duodenum as a result of exocrinal obstruction. Clear? Okay, those who have any doubts related with any of this pathophysiology, in the previous video I have explained each and everything in detail. So the link of that particular video I'll just post in the comment box. Okay. Okay, so the amount of pancreatic enzyme administered is adjusted to achieve normal growth. It should be like based on the patient's age or the child's age and the food amount of food which we consume. Clear? Enteric-coated pancreatic enzyme can be given, and pancreatic enzyme should not be given if child is to receive nothing by mouth, or if you are not giving anything orally, or if patient is kept NPO, you are not supposed to administer pancreatic juices. So please remember, pancreatic juices are only permitted to administer with food. Clear? And encourage well-balanced, high protein, high caloric diet, and multivitamin, and multivitamin can be given. And this is something very important. Vitamin A, D, E, K, that is something very important. You need to provide that. Why it is important? Because in case of cystic fibrosis, metabolism gets altered. So the metabolism of fat alters and altered metabolism causes steatorrhea. So the amount of fat which is digested properly is always reduced, and there may be chances to get a deficiency of ADEK. Okay, so you need to replace that. But please remember, when you replace vitamin ADEK, it is considered as a fat soluble vitamin, but you have to replace this is in the water soluble form that is commercially available. So you can administer that and monitor weight and monitor for constipation, because that is also a sign, and ensure adequate salt intake during extremely hot weather. This particular point is something very important, because the hallmark sign of cystic fibrosis is salty tasted skin or salty kiss. So normally we think that we need to reduce sodium, but no, sodium has to be given as per the requirement of a particular patient's body. Clear? So sodium has to be replaced as per the requirement, but you are not supposed to increase or restrict. Okay, so both are not necessary. Either restriction of sodium is not necessary, or replacing of sodium is also not necessary. Whatever amount of sodium does our body require, okay, that need to be given. Clear? So that particular point is very important, and for all nursing licensing exam, this gives a clear confusion. Okay, so usually the student get confused related with the replacement of sodium. But yes, sodium need to be replaced if you suspect that the patient's body is like literally excreting sodium faster. For example, if patient is dehydrated, or during a hot weather, normally we excrete more sodium. So in those situations, you can replace sodium. Otherwise, doesn't require. Clear? And what are the home care, which is instruct the parent about the prescribed treatment measures and their importance, and instruct the parent to be sure of immunization or to be update. Because see, why immunizations important? Okay, why it is important? This is important to prevent infections. Again, when this particular child get infected with any kind of disease, for example, if we take respiratory infection, the symptoms may get worsened. So you are not allow the child's symptoms to get worsened. For that, immunization is important. And inform the parent that the child should be vaccinated yearly influenza, because influenza vaccine is considered as an yearly vaccine that is normally helping to prevent getting in like flu infections, okay, or influenza infection. Pneumococcal vaccine may also be prescribed. These are the vaccines usually given to prevent in respiratory infection. There are other respiratory infections also. For example, DPT vaccine, BCG vaccine, and mumps and measles. All those vaccines are also helping to prevent infection. But influenza pneumococcal vaccine is not really considered as the scheduled vaccine. Okay, so this is like an optional vaccine. So you can just give additional education to the parent regarding the importance of influenza as well as pneumococcal vaccination, and inform the parent about cystic fibrosis foundations. These are the points that you need to remember. Clear? So far, we have discussed the cystic fibrosis investigation. What is the importance of performing investigations, and how do we manage? How do we manage respiratory system, and how do we manage GI system? And integumentary system, I have not specifically mentioned integumentary system, but yes, skin care is important, and sodium replacement, whereas sodium replacement is only necessary when it is really needed. Otherwise not, no restriction and no addition is required. But yes, if patient's body really requires that, yes, you have to replace that. And skin care is something very important. Clear? And one more system I just missed, that is reproductive system. Okay, so in reproductive system, the management is required only when needed. For example, this child, when they grow up and when they get married, and then in case if they have infertility issues, then obviously the management based on management will be completely based on that. Okay, otherwise you have to just remember that reproductive system is a system which is affected with the cystic fibrosis, but that normally will not, the symptoms will not be seen very soon. Clear? Okay, fine. So these are the points. If you have any doubts, you can just send a message through the comment box so I can reply you back. Okay, and all the very best, and please keep on watching. Thank you. God bless you.